You ready to do your appointment?
Let's do it.
Okay. So one of the things, usually I'll start out my appointments. We clean and checked your hearing aids. You've got your cross on. Perfect.
Got it all on and ready.
So then I want to go, while we're in the program settings, Justine also told me that she's having some issues with the Bluetooth. You did get a new phone.
I did get a new phone.
So we're going to pair the hearing aids to your new phone.
Okay, great. And while we're talking about this, maybe it was my other phone that was having a few issues, but when I wear my hearing aids and it's connected to my phone, and then I'm in the car, it keeps popping, jumping between the phone, my hearing aids. And then I also have the same issue when I use a Bluetooth speaker and I'm wearing my hearing aids.
Yep.
Everything keeps kind of popping back to my hearing aids, even though I resend it to
a different device.
To a different device.
Yep.
Is that a normal issue?
So that's something that patients are reporting, and part of it is the Bluetooth challenge. So they're all using the same signal. It's all Bluetooth. So the car is using Bluetooth, the hearing aids are using Bluetooth, your speakers. Your phone can connect to all of those simultaneously. But the downside of that is it does want to. Now, the phone thinks that your hearing aids are the dominant device. So usually whatever the first thing that's paired to your phone is, that's going to be your primary device. So I would say, let's get your car paired to the phone, your speaker paired to the phone, and do the hearing aids last and see if that helps it from jumping more. And you have an iPhone?
Yeah.
So that's what's different, because it's different iPhone versus Android. So there's some idiosyncrasies with these where it's kind of a challenge, because I also have to have a degree in like tech support, because that's half of the job is Bluetooth troubleshooting.
Yeah, honestly, it gets really frustrating. And then the other issue that I have with my hearing aids is that even if my phone is on silent and it's all the way in my bag in the other side of the room, if I get a call, it's ringing in my ear, not silently over there.
Right.
It's
very audibly.
Very distracting, but it's also making it very hard for me to find it when it goes off.
That's
right. So let's say I actually do have the volume on and someone calls and the ringer is somewhere in this room, but it's ringing in my ear. It messes with my perception or location services.
Yes, it is. Yeah, because
it's hard.
Again, it's those, usually the ringtones are those higher pitched sounds. So again, we're having a difficult time localizing it. You've got the cross and it's ringing in your ears. It almost makes it impossible to find.
It really does. I used to have it as a teacher. I used to have it somewhere. I would lose my phone all the time if I didn't have pockets, but it would be ringing in my ear. And I would have to say to the kids, is that ringing out loud? Or is it only ringing for me?
Just in my head.
And then if it was ringing out loud, someone find it and bring it to me. Like it's always difficult. But
do you ever use the buttons on the back to answer the phone call?
Never.
Okay, so maybe we'll talk through that, because
is that really a thing? I never ever use those buttons.
So I tell patients it's great because if you don't have your phone next to you, but again, you're answering blind. So if you don't know who's calling, we're going like old school landline where you don't have caller ID and it's a mystery of who's on the other side. But yes, if you didn't have
I just didn't want to end up touching the wrong button and it would mess with volume.
So when an incoming call is coming through, it won't do a volume. It's just doing, so when you push it to answer.
That's really good news there.
Yes, it won't affect the volume.
That's really helpful information.
And you can push either button on either hearing aid.
Okay, so I've got my phone. We are getting ready to sync the Bluetooth, in my new phone, I just got it yesterday, to my hearing aids. I just went into the Bluetooth on my phone and my hearing aids did not come up yet.
Not yet. Okay. So because I'm in your Bluetooth currently, did you want me to make any changes to the sound quality while I'm in the devices? So I'm connected to your hearing aids via Bluetooth. Love technology. And I can make the changes I can make the cross more sensitive. I can make it less sensitive. I can turn up the volume of the right ear.
I would like you to turn up the volume a touch.
On the right side? Or both? The cross more sensitive?
So you told me when I first put it on, if you scratch your hair and you hear it, that's how you know that the hearing aid is working.
Yep.
So I always do a scratch test because that was your little tip. And I hear it. It's light, but I hear it.
Okay.
See, I don't do that. I don't hear that.
Not as much on the right side?
Yeah, I think it's getting a little...
Yeah, let's go up on the right. And that's, that over time happens because the the brain, again, is constantly adjusting to the hearing aids, constantly getting used to the sound. And sometimes it wants more and sometimes it wants less. And a lot of it has to do with, our stress levels, our anxiety levels, our fatigue levels.
Yeah.
So it can fluctuate throughout the day. But, I want it to, every time we're in an appointment, I want it to feel audible and clear and comfortable, not too loud, not too soft, so that when you are in the real world, that you'll have a good range of where it's good to go louder and good to go softer.
Exactly.
Does this sound a little bit better? I did bring you right
I know,
up.
I heard it. I like clicked.
Just like a little bit
Yeah.
of a boost. But I would never want it to be too loud. So if I talk to you a little bit softer, it should still be audible. And if I talk to you louder, this should sound loud but not painful.
Yeah.
Okay.
That was good.
Okay, good.
Thanks.
Good?
Yeah.
Feels good right here?
Feels good.
Okay, so what I'm going to do is I'm going to disconnect. You're going to hear the hearing aids turn off for just a second. I've kept your programs the same. So Justine has 4 programs that she can cycle through her app. Normal would be your everyday. You've got crowd, restaurant, and television. And those are just some quick shortcut keys when you're in those environments to really help the hearing aids optimize for where you are. All right, you ready to pair to your phone?
Let's pair.
Okay, so we're going to turn both of your hearing aids off.
Okay, and I do that on my app.
You're actually going to do that on the push buttons. The
Okay.
bottom one, push and hold for 4 seconds.
All right, oh geez. Okay, my hair. 1, 2. Oh, I got it.
You're going to do the same on the cross side,
Okay.
but you won't hear the
I actually
melody.
never touch these buttons.
Really?
I don't want to mess with it. I feel like I'm just so nervous
Well,
that I'm
so-
going to 4 seconds on this one.
So if you did accidentally push a button, okay, one push will only change it by 2 dB, which is not a lot of volume. So, and you have about 4 steps in each direction going up and going down. The push buttons on your right ear are for volume. The push buttons on the left ear is for the cross sensitivity. So making it more or less sensitive. So it's if you did accidentally push it, it's not the end of the world.
Okay, well that's
And
good to know.
Every time you put the hearing aids in the charger, they go back to the normal setting. So you can't do any permanent damage with the buttons.
It's like a reset.
It is a reset.
Okay, so do I press it again?
You'll push the top button this time.
Oh, top button.
And then you'll do the same to the cross.
1, 2, 3.
And you're going to hear it come on.
Dun, 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 dun.
It's a beautiful rendition. Okay, but I love the startup sounds. All the hearing aids play a little startup jingle. And it's so important because that's how I know
Dun, dun.
that it's working.
Yeah.
Okay, that's important because if it's not making that sound, your hearing aid's
Just
not
did a
working.
beep.
So now you're going to go to accessibility. So iPhone
Okay.
settings.
iPhone settings.
And you're going to go to accessibility.
Accessibility.
And you're going to scroll down to hearing devices.
Hearing devices.
And then we're going to wait for it to search.
Oh. Justine's hearing aid.
Perfect.
Starkey Livio.
Yep.
You know, while we're waiting for this to connect, I just have to tell you, I don't know if you guys like the movie Grease, but you know when the woman gets on the like announcement radio
Yes.
to say like,
Welcome to Rydell High.
Rydell High. It goes dun, 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 like
It's
almost
the
that exact same sound.
I never even thought about that. It is the same. That's perfect.
I watched a lot of that before.
Grease is the good
and,
one.
oh, I love that movie. Okay. It is loading. Takes forever. Technology is great and also
It's a beautiful thing when it works.
But it works.
That's what I tell all my patients because it is. I mean, it's a love-hate relationship. It's amazing, but the more technology we introduce, the bigger chance we have of failure. Not complete failure, but some things not working, like the Bluetooth. So this happens.
So while we're waiting, I really want to bring up children and kids.
Yep.
And are these the same hearing aids that you would use for children?
So yes and no. When we do, so pediatric audiology is such an interesting beast in terms of the field of audiology. So I will say in terms of hearing healthcare for kids, we've gotten so much better in terms of being aggressive with intervention for those that want it. So we have, of course, in the deaf community, capital D deaf, there's some people that choose not to go with the hearing route, and that's okay. You become part of a community where you use sign language as your dominant way of communicating, and that's perfectly acceptable. So our job as audiologists is to be there to support those people, give them the resources that they need, and when someone wants intervention, that's where we really step in with the technology. Florida has a universal newborn hearing screening. So it is
Yes.
required by the state, by federal or by state law, that every child born in the state of Florida has to have a hearing test. Okay. Now, if you're born at home or you're born in a facility that's not a hospital, the state will literally come to your house and say, get your child checked, catch hearing loss early, and intervene earlier. Before it was school aged or it was a speech delay. And then getting hearing aids at that point, they're going to have speech therapy,
Yeah.
occupational therapy to get, to the milestones. But intervening, when the child is 6
early.
months old or
Exactly.
12 months old, they're developing speech at a normal rate and they're hitting all their milestones. So it's significant.
So when's the next time they get tested? Is like elementary school, right?
It is. And unless
That's
the
a long
pediatrician,
jump.
so sometimes the pediatricians are doing screenings in their office. I will frequently get referrals for failed pediatrician screenings.
See, I know that my kids have had vision tests
Yes.
in the pediatrician, but I haven't seen
A hearing test.
a hearing test.
It's not very common, and oftentimes they won't. It just depends on the office. Sometimes they won't test it unless the parent expresses a concern for hearing or speech delay.
So you know what also is very interesting is when I was a teacher in elementary school, when we were referring children to potentially be, tested
Yeah.
for different disabilities, especially ADHD.
Yeah.
One of the first things that a specialist will have you do is have a speech, or not a speech, go to an audiologist and have a hearing test because there's a chance that hearing loss or like a hearing issue may cause inattention.
Absolutely, and it's hard with kids because they can't tell us what the
Yeah.
problem is. So it's a guessing game. So audiologists will often see kids for evaluations for speech delay. We'll see them for ADHD, ADD, autism spectrum, Asperger's. Those evaluations they always group
Even
in
dwarfism, I
audiologists.
know they have a lot of hearing issues as well.
They do. Down syndrome, that's another one we monitor for conductive hearing loss. So the audiologist becomes a part of the pediatric care team very early on. And with kids, it's a lot of times the kids that I see, they fluid in the ears. So that's a very common cause of hearing loss with kids just because of their anatomy, this shape of the eustachian
So that's the
tube.
need of tubes,
Yes,
correct?
PE tubes.
And they come out by themselves
They do.
after a few years,
They
right?
do, yeah, because the PE tube goes through the eardrum to allow the fluid to drain out of the ears. And what the eardrum does, it heals, and so it closes. It's like a piece of skin. And when it closes, it pops that little tube out of the ear, and it falls out on its own. I mean, it's
Is
very
it like
tiny.
actually? So
It's
you
very
wouldn't know,
small.
or
No,
you
you probably wouldn't even see it. I mean, it'd fall out in your pillow or in the shower, in the bath, in the pool.
That's
and
so
you would never find it. Most people don't see the tube. We just look in their ears and we say, "Oh, your tube's out," and your eardrum is completely healed.
That's kind of cool.
It's very effective. It's amazing.
I know a lot of kids that need that nowadays,
Mm-hmm.
especially with a lot of like ear infections.
Yes, frequent ear infections. And again, because we're good about monitoring hearing, monitoring infections, we're catching it early rather than, these infections. One infection, you're not going to get tubes. If you're having multiple infections within 6 months, multiple within a year, then they're going to recommend tubes just to allow it to drain. And a lot of parents are nervous. I mean, I'm a parent, you're a parent. It's not something you're excited about when you know your kid needs surgery. The anesthesia is very mild. It's a very quick procedure, and it's instant changes. I mean, kids who were babbling before start to say mom, daddy. They're doing
amazing.
more words within a week of getting tubes because they can hear it better. Otherwise, they're underwater. I mean, they're not really, everything is muffled. It's not clear. So the change is very quick. It's very effective.
I love to hear that.
Yeah.
So parents, definitely have your children's hearing checked. And if you're not in Florida where it's mandatory at birth, we suggest that you get your child's hearing tested.
Yeah.
And where could they just go to an audiologist?
So, yep, you can go to your local audiologist. You can start with your pediatrician. They're always going to have a team of audiologists that they refer to. And again, if you're concerned, I always say the parents know the patient the best, okay?
Yeah.
So you guys know your kids better than anybody. If you have a concern, absolutely get it checked. And my favorite appointments are when the hearing looks great and all the tests are normal. And I can say, let's see them again in a few years if there's any concerns, if they're not doing well in speech therapy. But otherwise, I'm not going to see them until they're, in their 60s and 70s. So it's, it's not something to be afraid of. I love, answering all the questions and concerns, because as a parent myself, I know that when you think that there could be something that we need to intervene medically with a child, there's a lot of anxiety that comes with it. So I always try to create an atmosphere where parents more so can feel very comfortable with what we're doing.
I love that. And also notice the signs from your children. I had a few students who would turn to one side and say, "What?" Or I would have to say their name multiple times, repeat it over and over and over again. And that's one of the other signs of ADHD, is that hyper focus, where you kind of tune all the other sounds out. But ruling out hearing issues is so important, especially at a young age.
It is.
So my phone totally just stopped. Oh, it got it. That was easy.
I know. That was all we had to do is just talk. So
we just needed to give it time.
So they're connected, and then you can open your app and just make sure that connects.
Really crazy statistic about is tinnitus. And I have heard it pronounced two separate ways, tinnitus and tinnitus. And no matter which way I say it, someone tries to correct me.
Always. I have patients try to correct me. I'll say it in an appointment. They'll say, "You mean tinnitus?" And I'm like, okay.
Okay.
So tinnitus and tinnitus are both accepted in the world of audiology. I mean, I usually don't correct patients when they say tinnitus, because I know what they're saying. And it just depends on where you learned the term from. So I was taught tinnitus. I went to school in North America, but if I had gone to school in England or somewhere in Asia, they would say tinnitus. So it is accepted in both ways, but tinnitus is how I say it. But yeah, it's tinnitus affects 59 million Americans. So when people talk, people don't talk about it enough, but when people mention it, when I tell them how many people suffer from it, they're surprised by that, because we're just not discussing it. Even my own husband, I was in graduate school and we were talking about it amongst friends, and he's like, wait, you guys don't hear a ringing sound when it's really quiet? And I was like, no, we don't. So he suffers from tinnitus. So it's
so let's
very
talk
common.
about what it is first.
Tinnitus is defined as, it can be a ringing, humming, buzzing, chirping, typewriter, cicada, crickets, any sound that can't be localized to an external source. And usually it's coming from the ears or from the head.
So when I first came to you, and I didn't have hearing aids, and I was telling you I have such bad tinnitus that sometimes it almost is like I black out. Like I can't do anything. I get nauseous. My eyes close. It's like I could see inside my eyes. If I closed my eyes, I could almost picture a line like in my head going from side to side, that it just is debilitating.
It is.
And you said it's your brain making up the sound you're missing.
Yes. So this is where, and this is my favorite way to describe tinnitus, because I think people can understand it more. It is neurologic. So the brain is producing the sound, okay? And I compare it to phantom limb syndrome. So if you don't know, if someone loses an arm or a leg, they can experience something called phantom limb syndrome, where they perceive pain from that missing limb. So scientists wanted to figure out, well, what causes that? When the brain perceives that loss of the body part, it's sending neurologic signals to that missing piece. We perceive that as pain. When we have a hearing loss and the brain perceives a loss, it's sending neurologic signals to the ears. We don't feel pain, we hear sound. Okay, so that is really to me, the easiest way to describe why we have tinnitus, because of hearing loss. Now, there's a lot of other things that can cause tinnitus. You could have a virus, you could have stress, anxiety, fatigue, caffeine intake. So coffee and chocolate are big triggers.
Why would you do me like that?
I know. Everyone gets so offended when I say that.
Chocolate?
I know.
No.
It's like two of the best things in the whole world. Head trauma, whiplash, neurologic diseases and disorders can also cause it. So because there are so many factors, that's why we don't have a cure. And for most neurologic diseases, we don't have a cure for. So it's very difficult to treat. But we do have, as audiologists, we have like a rehabilitation program for tinnitus for patients that really are suffering. Some people have tinnitus and it's, I hear it. And some people have tinnitus where it's dominating their life, where they become suicidal. They just
want to make it stop.
They do. And they, again, become depressed, socially isolated. It really takes over and affects their quality of life. And we really want to try to intervene before we get to that point. But the theory of tinnitus with phantom limb syndrome is, if we give the brain back the sound that it's missing, the tinnitus gets better. 60% of patients with hearing aids and tinnitus, it does get better or goes away. And then there's 40% that there's no change.
That's interesting. I follow someone who is like a tinnitus specialist who works at like a center that also does surgery.
Yes.
So what kind of a surgery helps that?
So that would be more if people had sometimes a physiologic tinnitus. So there are patients who would stick their tongue out and their ears would ring. So that's a physiologic tinnitus where
It's all connected.
it is. If anything is touching the auditory nerve, we're going to hear sound because that's what stimulates the auditory nerve. So usually if there's a surgery of anatomically, if they could move things around or remove something, that would alleviate their tinnitus. So that would not be related to a hearing loss type. But it's a very risky surgery because the auditory nerve runs right next to the facial nerve.
That's why I didn't get that surgery, is because there was such a chance that I could lose feeling.
Yeah, facial nerve paralysis.
So my parents were like, it's not worth it.
It is. It's any ear surgery, especially when we go around this side, is very risky. I mean, you could end up with acoustic paralysis, which would be complete deafness. You could have vestibular paralysis, which would be dizziness, constant, where you would have no balance function, and then also facial nerve paralysis. So it is a riskier surgery, and oftentimes physicians don't want to touch it. But if they do, they have audiologists that work in the operating room to do monitoring of those nerves, and they'll tell the physician, you're touching this or you're getting too close to that, so that they can make sure those nerves stay intact.
So you brought up dizziness, and I want to talk about vertigo.
Yay.
Because I never thought about this as something an audiologist or an ENT does.
Yep.
But my husband was doing a ridiculous amount of push-ups this one time. This sounds like such a fake story, but it's so true.
It's such a guy thing.
Such a guy thing. Sorry, Todd.
Yeah,
but
shout out.
Shout out to Todd. But he was doing hundreds of push-ups, and he was going kind of fast. And before we know it, he got so dizzy, and a dizziness that came with nausea, and he couldn't shake it. He could not shake it. And it got to a point where he got sick, like started throwing up, couldn't do anything, didn't feel comfortable driving. So I brought him to you, and it was one of the craziest things I have ever seen. And you laid him back on a table. You turned his neck like ever so slightly, and his eyes started just going back and forth, dancing.
Yeah.
And you're like, oh, it's vertigo. Here,
Yep.
just don't move your head. Wear a neck brace for like 2 weeks and you're fine. Like slow down with your push-ups.
Yes.
And it was so crazy. He felt so much better like right away.
You know, positional vertigo is what he had. So it's BPPV, and that stands for benign paroxysmal positional vertigo. Such a mouthful. But it's a condition that affects the inner ear. And this is another really common dizzy disorder that people suffer from. Again, it's treated by audiologists. It's not a common thing that people are aware of that audiologists do. And not all of us do it. You have to have a specialty in vestibular disorders. And in your clinical rotations and in your residency, we do programs for specifically training for this. So doing V&G tests where you wear goggles and you're in a dark room, and we're looking at your vestibular system, which is your balance organ in the inner ear, the connection between that and your eyes and your brain.
You did say something about that, that it was moving.
Yes. So the crystals in the inner ear
The crystals.
Yes. Those are critical. Everyone's like, can you just take them out? No, we need the crystals. We need those crystals. And those are when they're moving in fluid, okay, that's normal. That's how our head knows where our body is. So when you have, in Todd's condition, and usually it's due to age, okay? So that's the most of the time I see it, older adults. But we see young people who have it usually due to physical trauma. So
like a car accident, whiplash, anything like that.
Bumping your head, that stop and go impulse that he was doing with the push-ups, I mean, that's certainly enough to do it. Oftentimes in yoga because of your head position. So the crystals in his case were floating around where they didn't belong. So when he would do simple movements, it would feel like the room was spinning around him. So that's kind of a telltale sign of BPPV, is laying down in bed, rolling to one side, bending over, looking up. If that gives you a room spinning sensation for a few seconds, you usually have BPPV. And we do an Epley maneuver, which you saw, very effective treatment.
Literally.
Yep, it's a turn of the head. It's moving the head and body and I compare it to the little, the maze games with the silver ball. That's what we're doing with the crystals with Todd's head to put them back where they belong. And it's super effective. Dr. Epley was amazing to come up with this because it really helps people who are suffering from this
And it's
disorder.
non-invasive. It was very quick,
my gosh,
super
so easy.
and then he just kind of had to not move.
Yep. That's the worst part. It's just not moving afterwards
really
for
is hard.
48 hours.
So I also really wanted to bring up hearing loss
Yep.
because it does affect so many people in different ways. And I know, obviously, I have a different type of hearing loss, but I know someone who back in the early 2000s was playing something that kind of went viral, and it was a slap contest.
Oh, geez.
You would slap someone and then they would slap you, and the person who bowed out was the loser. And this one kid got slapped so hard, not in the face. The guy missed and hit him in the ear.
Oof.
He ended up going deaf in that ear.
Yeah. We actually call that the kiss of deaf, DEAF. Because, and this can happen if someone actually, the term kiss came from someone kissed the ear, okay, on the ear. And that suction created a burst in the middle ear that caused hearing loss. Okay?
And I bet that's very painful.
So painful because it's basically your eardrum moving.
Like pop.
The chain of the bones in the middle ear separating. It's very physically painful, but it's usually due to trauma like that. A smack directly to the side of the head, that kind of head trauma. It's called, it can also happen with, scuba diving or changes in pressure changes.
Yeah.
It's a barotrauma burst in the middle ear that causes hearing loss. And it's, it's such our ear system, for being so small, it's such a delicate thing. And those types of trauma incidences do cause hearing loss, and it can be irreparable. I mean, sometimes they can do surgery for it, but sometimes they can't.
It was really sad and very terrible. He was in a lot of pain for a long time. So what about other types of hearing loss?
Yeah.
Do you hear about it from like loud noises now that people are going to like music conferences or
for
festivals?
Sure. And that's something that we've seen a lot of. We're calling it the iPod generation in the industry because we've got, when we grew up, we had...
You're putting sound right into your ear all the time.
Exactly. When we grew up, we had headphones or the foam headphones. We just didn't get that close to the eardrum. But now we've got these noise canceling all the way in the ear canal, and people are listening to them at loud levels for long periods of time. They put them in for hours a day. So I usually tell patients, if you keep your volume on your phone at like 75% of the maximum, that's a safe listening level over long term. Higher than that, we're going to start to see noise-induced hearing loss, which again is permanent. So it's try to stress to people, especially when they're young, protect your ears when you go to these concerts. They're so loud.
They are so loud.
Those
I wear earplugs all the time. And I remember this was years and years ago. I was at Ultra, shout out to Miami, and I was wearing earplugs. And one of the people who I bought water from, like a vendor, was complimenting me and saying, you're the only person I've seen today protect their hearing.
It's so true. People don't do it enough. We go to concerts with my friends who are audiologists, and we all roll up our foam and put it in.
Yeah.
And your concert experience doesn't change. You're still hearing everything that everyone else is, but you're protecting your ears. I look at all these young people, and for me, it's good because that's the future of my career. It's good job security, but I don't want people to induce hearing loss earlier. I want them to be older when they have to come and see me. So we are identifying noise-induced hearing loss in kids that are younger. But also the range of hearing that's affected by noise is also affected by age. So you're going to have double compounding hearing loss because of your noise exposure when you get older.
Yeah.
The other type of hearing loss that I wanted to comment, especially with your case, for microtia and atresia patients, we talked about the cross, which is an excellent technological solution. But there's also a surgical solution called a Baha. So it's a bone-anchored hearing aid.
This is something she has talked to me about that I am really, you said, like a perfect patient for.
You are. You're the textbook patient for it. Somebody who doesn't have an outer ear or an ear canal, or they have a severe conductive hearing loss. They, again, design this for them.
So what is Baha? What does that stand for?
It's bone-anchored hearing aid. So it does require a surgery. And there's two options. They can put an abutment, which is like a little screw right behind the ear, very similar to where you wear the cross. And then they also have a magnet option as well, so there's nothing really sticking out. But it's a processor that stimulates the bone directly, so it gives you hearing from that side. And again, it's restoring the hearing to normal on that side of the head, the affected side. So
when I saw an audiologist years and years ago, they actually used to test my nerve.
Yeah, so they were looking for function of the cochlea. So
yes.
That's your inner ear, and when we tested you, your inner ear function in your cochlea on your left side is completely normal. So the cochlea developed normally. but we just can't get the sound to
See,
it.
that was always like a backup plan. Like, God forbid I ever lost my hearing in my right ear, that I would be a candidate for a cochlear implant.
So and also for a Baha. Because that's where we need a Baha you cannot have if you have a hearing loss on that side. You need a good functioning cochlea to use the Baha. So that's a good thing.
So if I was to get a Baha now, but then in the future lose my hearing, does that impact my ability to get a cochlear implant?
No, it doesn't, because the Baha doesn't affect the cochlea.
Okay.
So that's the nice part.
Okay, that is good to know that I still have all those options.
Exactly. The Baha helps to stimulate the cochlea to produce sound, to go to the brain. And it does it through the bone, okay? And that's why when they test you, they put the headband on the bone oscillator to go straight to the cochlea and bypass what's happening in the ear canal.
Is there any closing remarks, any information, tidbits, something to give out to parents and the watchers?
Yeah. I would just say, for people who have any questions or concerns, again, super biased, but audiologists really enjoy talking about this with patients. We really enjoy connecting with patients, hearing about a patient's journey, because as you can hear, there are so many solutions. I mean, hearing aids are one part of what we do, but tinnitus therapy, vertigo treatments, you've got people who specialize in Bahas, in cochlear implants, in pediatric hearing aids. So every sector of audiology, there's a specialty for people who are really having concerns or pain points, and we want to help people through that. So I always encourage you, find your local audiologist. You can find them at an ENT office. There are a ton of private practice audiologists all over the country, and that are really focused on helping people where they can. So reach out to them if you have any concerns. Get your hearing checked. I mean, we're so good about checking our hearing. I mean, if there's, in elementary school, you get your hearing checked, but then we have this like 40-year gap where we're just not looking at our hearing loss. And by the time it's set in, we don't know how quickly it has progressed. Is this a fast progression of your hearing loss? Is it slow? Is this a new hearing loss? We don't know.
When I talk about my hearing loss and the fact that I'm deaf in my left ear, so many people tell me, oh, I'm deaf in my whatever ear, or I have some hearing loss. I'm like, oh, did you see an audiologist? Do you have some hearing aids? And they just say no.
Yeah.
You should totally get that checked out. There's a lot of help out there.
I'd love to normalize getting your hearing checked. The stigma is getting better with hearing loss. I mean, they used to commit people who had hearing loss because they thought that they were crazy or they couldn't contribute to society. So we have come a long way, but I do think there's a long way to go.
I actually say that all the time. Like, if I was born hundreds and hundreds of years ago as this deformed little baby, they would have left me on the side of a hill. Like, they would not have given me a chance, especially the fact that I was a girl too.
Yeah.
I'm done.
This is why what you do, Justine, is so important, because it gives a voice to people who may feel uncomfortable to talk about it. They may not know enough about it, but you're educating people on what they have access to, what's out there, what you can do to help yourself. Even if you don't feel comfortable, you have people like Justine out here who are really fighting for what you need in terms of school and education and workplace. And, there really is a lot of room for people to thrive with a hearing loss. So I want to kind of normalize getting a good checkup.
Be your own advocate. Be your advocate for yourself and your children, your loved ones. If somebody is showing signs or in pain or discomfort when it comes to their hearing or dizziness, balance issues.
Yeah, that's another big one.
Go ahead and get checked. There's no downside to getting more information about yourself. And the more information you have, the better you can help yourself.
Yeah, it has such an impact on our quality of life. So if there are things that we can do to improve that, I mean, it's a short time that we have together, and it really just impacts somebody's day-to-day so significantly that it's worth looking into.
Absolutely. So thank you so much, Dr. Gracey, for coming down here and doing this with me. It was informative and fun, and I always have a good time with you.
Me too. And thank you so much for doing what you do for the hearing community. And it was my pleasure coming down, and this was such a fun day. I loved it.
I love this. Like you said, like just nerds getting together,
giving
out information, whether you asked for it or not.
That's right.
But tune in next week for another episode of the Completely Me podcast with Dr. Justine Green. Have a great day. Tune in next week for part 2 of this Completely Me podcast episode featuring Dr. Gracey. Thanks for watching. If you enjoyed that video, be sure to hit the like button. To learn more about child development, parenting, and the disabled world, make sure to hit subscribe. Also, don't forget to sign up for the Completely Me activity kits that your little ones will love. See you again soon.